What's going on, you guys? So we back with another Tattoo Talk Atlanta, and today we got Nikia in the building. How you doing?
I'm good. How are you this
I'm
morning?
doing good. I'm doing good. So we here in your office. Well, I call it your office because you run stuff around here, and I thought it would be interesting to show people exactly like what goes on behind the scenes in the eye lens or optical, world. So if you can, just go ahead and introduce yourself, and then we'll go from there.
Okay. Well, I'm nikiamercardante,
Okay.
and I didn't even know this place existed. A doctor found me and offered me a job
Really? Here?
That's
crazy.
Yes.
And what doctor is that?
Dr. Lyle Lastiger.
Okay.
I've been with him. January will be 11 years or 12 years. 11 years, I think.
Wow. So y'all got history.
We do.
History. So me and you've been knowing each other for what? 4 years? 5 years? No.
Longer than that.
Holy shit. It's been like 10 years almost, right?
Yeah.
Wow. Okay. So me and you met through Tom.
Right.
Which I call him my grandpa, which is Lyle's best friend, Dr.
Right.
L. Okay. So let's tell people a little bit about what you do here. Like, how is it here?
We can help you if you have something in your eye. We can help you if you have eye infections.
Okay.
We can come in and give you a full workup for diabetes retinopathy exam if you need one.
Okay.
As well as if you come in and you want to be fitted for glasses or contact lenses, we handle that here. We also edge glasses in-house.
Okay.
So if you want to keep your old frame that you're wearing and not change over to something new, you don't have to be without it. Once I get your lenses in, if they're not stock and they have to be surfaced, I call you in and edge them while you wait.
Okay, so what she's saying, you guys, for the people that don't understand eye doctor talk, is you can go online, or if you have your favorite pair of lenses that you like, frames, you can come here, get your prescription done, and then they can send you some lenses off, right? And then get them back and cut them custom to the glasses,
right?
Kind of deal. Because I know a lot of people always ask me like, where you get your glasses and who do them and all that stuff. And so you guys always touch my eyes since I known y'all. If somebody wanted to get into doing eyewear, right? Like where would they start at? Like how, kind of give people, because I don't know a lot about this. All I know is like, I can't see something or something get in my eye. I'm like, hey, let's go to the eye doctor, right? But people don't really know like what goes on. Like what's this about? You know what I'm saying? So can you kind of...
So with this place, it's kind of all hands on deck.
Okay.
So you come in the door and we're going to train you from answering the phone to scheduling appointments to being able to verify insurance. So if you're using any kind of optical insurance or eye insurance, we're able to pull up that. Tell you what your benefits are, discuss that with you a little bit. That way you know what you're looking at. And then once that patient sees the doctor, we handle the pre-testing prior to them going in to see the doctor. We train you on that. 3 different machines. One is an auto refractor, gives you the baseline of what your prescription is without correction.
So what's that? Say that again.
Auto refractor.
What's that?
So what the doctor does when he writes your prescription is he does a refraction on your eyes, and that's to tell you what you need as far as prescription to correct you to be able to see 20/20.
So what about the LASIK stuff that they're doing? Y'all do that here?
We do not do that here.
Okay.
He's not a surgeon. He's just an optometrist.
Okay,
but
so
we do refer out. Yes.
So it's a difference.
There is a difference.
Okay. Like when clients come in, right? We really don't know. It's almost like when people come to the tattoo shop, like they know what they want, but they don't know how to explain what they want, right? So if I came in and I couldn't, like if I had something in my eye, right, and I came in, do y'all like, is that considered as like a visit, or is that like how does that work?
If you have something in your eye, it's considered like a medical office visit.
Okay.
So you're not going to be subjected to all the pre-testing unless he asks it. You're going to go straight back and see him. He's going to put some medication in your eye to numb it. Then he's going to use a little strip that's called fluorescein, and it's going to make whatever's in your eye light up that he can see underneath a special light.
So I got a question too. The little test y'all do with the balloon, right?
That's the auto refractor.
So does it like shoot air into your eye? Like what's going on with that damn thing?
Okay, so that's the last one, and that's to check the pressure in your eye, and that's a glaucoma check.
Check the pressure.
Yes.
So you have pressure in your eye.
You do. That's how your eye stays nice and round and in there. Yeah.
So you're saying my eyes are blown?
Pretty much. It's got like get jelly in there.
No way. Huh. Wow. So on that, yeah, I do notice that when I went back there, y'all have like a 3-step process thingy. Like, can you explain what those little 3 things are?
So the first one was the autorefractor that I was speaking of.
Okay, and that's the one that does
that's like the first one that gets blurry and clear with the balloon at the end of the road.
Okay, and
that
what does
gives
that
you that
focus
baseline prescription without correction.
Gotcha.
It just gives him a ballpark where to start when he goes, is that better or that better? 1 or 2.
Gotcha.
That gives him a baseline where to start.
Okay.
The second one that flashes really bright, that's a fundus photography. And what that does is it takes a photograph of the inside of your eye.
Okay.
It's kind of like an X-ray.
Okay, for the eyeball.
So he can see if you're having any kind of macular degeneration, which can show up as like leaking. It can wet or dry. That can cause. It's treatable now.
You said leaking?
Yeah.
So
you have the leads in your eye. You can get those.
Really?
Yeah. The pictures also can tell you if you have high blood pressure.
Really?
If you have diabetic retinopathy. Yeah, your eyes tell a lot about your health. I didn't know that either, but now I'm like, wow, that's cool. He can see so much in there.
Really?
He's been able to see that people's had tumors before. You can have arthritis in your eye.
Holy.
Yeah, lots and lots of stuff.
So the second machine
shows all that stuff.
And then the
third one, that puff of air, the one that gets everybody. If you didn't jump, I would think something was wrong with you. Gotcha. But it checks the pressure in there, and it blows a puff of air. People say it feels like it spits in your eye, but it doesn't. It's just air. But
so y'all come in the morning, everybody standing in the line and be like, put the spit in the bag, y'all.
Right. So with that being said, it blows that puff of air, and then it registers back to let us know what your ocular pressure is. Ocular pressure.
Okay, and so with the covering your eye and looking at the shapes and stuff, like what procedure, what step is that one? You know what I'm talking about? Do y'all still do that?
He does it.
Okay.
In that room with him. And so with that, that's just fine tuning that prescription, just seeing what you're seeing at best. And we want to determine which eye is your dominant eye as well. So that helps with that. But when it comes to that pressure, it's very, very important that we keep an eye on that, because if it is high, then we have a glaucoma suspect. So we need to get you taken care of, because now you can treat it with drops. Back in the day, it just meant you were going to go blind. But
so, oh, really? So I have floaties, right?
Mm-hmm.
How do y'all deal with those things?
Unfortunately, it's like trash in your eye.
Yeah.
If it gets severe enough, there is a surgical procedure that can be done for that, but it's not something that he recommends off bat unless it's something that is just unbearable. With that, you just kind of have to wait it out. Once it floats over and sticks to the jelly on the side of your eye, then you won't see it anymore. But until then, it's just trash floating around in your eye pretty much. Gotcha.
And so I came in here recently because I had a swollen eye.
Yes, you
did. You guys gave me some drops and it was gone in like a few hours, like totally like clear. What kind of medicines, right? Like, oh, let me ask you this first. As we get older, our body starts to change, right?
Of course.
Like I said, when I first came in here today, I was like, your coworker was talking about she had breakfast, and I was like, I had carrots, right, for breakfast. Is that a true attachment to the eyes? Like the carrots make your eyes better?
No.
So it's no benefit at all?
No benefit at all. We were lied to as kids. Sitting too close to the TV doesn't have anything at all to do with it.
So let's unpack some of these folk tales, like some stuff you done heard that you like. Not true since I've been working here. So sitting too close to the TV, false.
False.
Eating carrots, false. What other statements? What other things they say?
Not wearing your glasses will make your eyes worse. False.
I never heard that before. Okay, so let me ask you this: contacts, glasses. Which one would you prefer for somebody that's needing, new eye accessory or whatever?
It really depends on that actual prescription.
Okay.
If you're just, say, around mine of your age, we're not needing a bifocal yet, contacts are more easy to deal with. Once you start getting into presbyopia, which is where you're needing a bifocal, then when you get into those contact lenses, it can be hit or miss.
Okay.
It's more along the lines now we're trying to find you 20 happy, not 20/20, because to see good up close, you're going to give up some far away. To see good far away, you're going to give up some up close. So some people will still wear their just spherical distance contacts.
Okay.
And then wear reading glasses for up close.
So what's a spherical difference? Because I know I have like a few different kind of contacts, right? What's the?
Yes, you got some astigmatism going on.
Yeah, I know. I got them in both.
Yeah, so spherical is just going to be, you just have that one number.
Okay.
And when you get into astigmatism, we have to take into effect your cylinder as well as your axis. And that's just to deal with the shape of your eye. It doesn't mean there's anything bad wrong with your eye. It's just the way that your eye is shaped and how the light comes in. You need that full prescription help, not just distance.
Okay, because I know at night when I'm driving, when the lights hit me.
Oh, you can see the starburst.
Man, it's over with. Like literally.
That's that astigmatism.
That's what that is. Mm-hmm. And then I was diagnosed with cataracts too, right? In one of my eyes. Yes. So can you talk a little bit about the cataract thing?
I would love to. Actually, I just took my mother on the first to have her right eye done. That was fun experience. It has taken us 5 years to talk her into getting this done. And now she's like, why did I wait so long? So a cataract is a film that grows in to where your lens is in your eye.
Okay.
It develops over time.
Okay.
Nobody can put a timetable on how long it's going to take for it to be ready enough to be removed via surgery. It's just up to your body.
Okay.
So you can have the beginnings of them and it stay that way for years. You can get it and come back next year and he can say, oh, we need to send you for surgery. Glasses are not going to help. One of the down parts of this job is you come to the eye doctor and your whole life, he's able to fine tune your prescription and make you see better.
Uh-huh.
Once we get to that age that cataracts develop, then we don't understand why he can't make us see better with just new glasses.
Because it's almost like teeth. You have cavity on top of your eyes.
Exactly. So until we get that film out, you're not going to be able to see. But that procedure takes like 5 minutes. They give you something to make you nice and relaxed. Put you in like a twilight zone. You don't really know what's happening. They go in there and they make a small incision, remove that cataract film, and while they're in there, they insert a lens that corrects your vision.
Really? Takes 5 minutes. Mm-hmm. And what's the cost associated with it?
It depends with like your insurance company.
Okay.
Like my mom has United Healthcare. I think it's about $300.
Okay.
So it wasn't that bad.
Without insurance?
It could be a couple thousand.
Yeah. Without insurance. Is it so you recommend if somebody needs to get it done, get it done?
Get your health insurance. That's definitely going to help you. And I asked my mom what the worst part was, and she said getting the IV.
So they put you under.
Well, you're in the twilight. You're awake.
Okay.
Because you have to be able to look at what they want you to do. And so now she's walking around and she can see great out of the one eye, but the other eye, she's like, I just can't believe everything looks so dim, but everything's so bright. And I was like, I know, I've been telling you this for 5 years.
That's cool. So another question, right? Do y'all have procedures that y'all do to make, the kind of like when you do the dilation? Mm-hmm. Like what's that about? Like when you dilute the eyes and you say you can't drive or you can't do certain stuff, like can you explain why?
Why we have to do that?
Yeah.
So primarily it's your insurance. We only dilate you here if you're a diabetic or if the cataract is so bad he needs to open up your eye to be able to see in there better. Oh. Now some doctors dilate you no matter what the minute you walk in the door, but he does not. But the insurance company requires it, and what that does is it opens up your eye, your pupil will get really big. I call it hoot owl eyes. So he can see in there and see what's going on better. But it's 3 different drops. The first one numbs it, and then the other 2 are the medications that dilate your pupil so he can see in there better. And that's really, it's just, you're blurry for a couple of hours, sensitive to light, but you can see. You just can't see to read, but you can see to drive. Okay, cool. So last question I got for you. Yeah. Since you're a professional and I've tattooed you before. Yes.
So let's talk about why you got tattooed and how old were you when you got your first one?
I was 18.
Okay.
And I wanted a tattoo. And my dad said, well, are you going to go to prom? And I was like, no. He I'll pay for your first tattoo then.
Really? Yeah. You didn't go to prom?
I didn't go to prom my senior year. I went my junior. It wasn't all I thought it'd be.
I got you.
So,
I got you.
I got a silly little sunshine on my right thigh because their thing was, it's your first tattoo. Make sure you get it where it can be covered up because you're probably going to hate it when you get older.
Okay.
And just make sure it's tasteful.
Were they right? Do you hate it?
I wish it was a different color.
So you agree, like, because a lot of people come in and they're like, "Why I got to be 18 to get tattooed?" Right? And I look at it because I've been doing it for a while. I look at it like, you guys don't really understand what y'all want right now. And sometimes I be wishing that the age was a little bit higher because still at 18, you know, you get people coming in and get stuff on their face and stuff like that, and it's like, dude, you got a whole life to live. Like, why would you do that to yourself? But. And so, how do you feel about people with tattoos?
Well, I enjoy them myself.
Okay.
Color, usually every tattoo has a story behind it.
True. That's true.
And there's some people I respect you if you don't like them. That's fine. Mine are more now remembrance pieces. Like the piece that you fixed on my back for me, that was for my father. Yeah. I lost him. And then, you know, getting to share those memories with my mom as you tattooed her, that was great because my father could never get her to do it. But the fact that your artistry was able to take something that I did not like at all the first time because another artist had did it and you corrected it to be something that I was proud of, I was like...
Yeah, no, it's sick though. It's a pretty cool tattoo. Yeah. Pretty cool. And so I tattooed your husband also. Yes. And I did, two. I know I did the army guy, and then I did the boots and skull. So I did two tattoos on him so far. And so her husband and her mom came and got tattooed by me. And I wish her mom was here because she is so funny.
She told me to tell you hey this morning.
Yeah. And I want to tell her hey too. So we're going to let Nikia get back to work. And we thank you so much for your time. And good luck on everything.
Same to you.
All right. Peace.